So some supplements that you can discuss with your vet in terms of what would be good for either preventing this or slowing the progression. Um, Omega-3 in the form of fish oils. So that is helpful for joints because it decreases inflammation, helpful for skin and coat health. It also helps with cognition or brain function. So I love fish oils. But go slow to decrease any stomach upset. My little French bulldog gets some gas if I give him too much. So I do kind of an every other day administration for him. Joint supplements. This is going to be super important, especially, this is a husky dog here. So for our medium and bigger dogs, I like to start them early, especially if they're like running and active, around 1 to 2 years of age. There's some great ones out there. Talk to your vet about, depending on what size dog you have or what kind of breed or what activity levels, glucosamine, chondroitin, GLM, MSM, turmeric, those can all be super beneficial, again, to prevent or even just like slow the progression of arthritis or osteo issues. Turmeric, that's a very potent anti-inflammatory. That can be found in conjunction with joint supplements, or you can do, it's called like golden paste. You can give it to your dogs that way. Some dogs don't like the taste of it. So sometimes I tell clients to blend it up in like a little bit of like a nut butter or some coconut oil to give the turmeric to, but there's some good joint supplements that have turmeric in it. Boswellia, there's been a few studies that have shown that it helps in specific osteoarthritis cases. So again, talk to your vet before introducing any supplements, but that's a relatively safe supplement that you can give if they do currently have osteoarthritis, decreases pain, decreases inflammation. And like I said, it's relatively safe. Adequan injections. So a lot of my clients will do this at home. It's really easy to learn. And again, talk to your veterinarian about if this is good for your pet or not, but it's chondroprotective, meaning it's going to protect like the joint fluid and the cartilage within joints, and just really be protective of that from degenerating any further. Traumeel or T relief. This is an over-the-counter medication. It's a natural anti-inflammatory. Again, talk to your vet. But that's, it's less harsh on the body than a non-steroidal anti-inflammatory. CBD. There are different laws in different states and different countries, but the bottom line is you have to find a good quality. It can't be just ordered. Not all of them are good quality. So I just urge you to, again, talk to your veterinarian, do your research a little bit and find a good quality CBD oil. Chinese herbs, these can work wonders, but you need to find an integrative or a holistic veterinarian to really work with you, because patterns in Chinese medicine can change over time. And so, there's also not a one herb fits all for what your pet might be going through. So definitely finding an integrative or holistic veterinarian to help you with that process is going to be key. So other natural pain relief modalities, acupuncture. This is Kona again, and you can see these little acupuncture needles in her, and helping her with her knee pain and arthritis after 2 surgeries on her knee, and her little elbows that just have severe arthritis. So if we need to give Western medications, I start with that, but I also start pretty quickly with acupuncture. And that is basically inserting these small sterile needles into specific points at different meridians to help with pain, help move qi, or basically stagnation in the body, and just help the body balance itself. And they've done research on this, but it decreases inflammation, it activates endorphins, and it releases some trigger points and muscle adhesions and everything in the body to release that and make the patient feel better. And it also just relaxes the patient. So I love acupuncture. I also love laser therapy. And that is basically wavelengths of light that penetrate the tissue to decrease inflammation, eases muscle tension, enhances healing. So I do that in combination. I put in acupuncture needles, and then I do a non-contact probe over it. If they're super painful, then I'll start with the laser therapy. Physical therapy, you can do water treadmills, specific exercises fit for your dog and what they need, and they can show you things to do at home, like stretches, chiropractic care, massage, which is huge, and strengthening those muscles because these can get really weak, especially with age, just like humans. There's something else called the Assisi loop, and it's PEMF, which is pulsed electromagnetic field therapy. And it basically is like a loop, and you put it on certain body parts. Like I used to put it on her elbows, and it helps with cellular repair, pain, edema, which is kind of swelling of that specific area. And a lot of clients can do that on their own at home, so that's really wonderful. There's also gua sha. It's a massage technique, and it basically helps the underlying fascia and the soft tissue. It helps to release adhesions, release trigger points. It's similar to cupping or foam rolling in humans. So if you've ever done cupping or like rolled out, like I have to roll out my T-band and it like, it's like a good hurt, but I feel so much better afterwards. So you can also do that at home. Heating or ice, kind of depending on what's going on, that's going to be super helpful. And then something called PRP. This is done by specialists, usually in the surgery department of specialty hospitals. It's called platelet-rich plasma. So basically, they take some blood, spin it down, and get that plasma out and inject it into specific joints that are hurting them, and growth factors in their own plasma and their own blood essentially helps heal and repair those damaged joint tissues. So that's definitely something to look into as well.